So why would I eat red meat? Well, it's because people who had red meat are more likely to have cancer. It doesn't mean that the red meat causes them to have cancer. It's it's causality versus correlation.
Hmm.
So it's just like people who drive pickup trucks are more likely to have cancer than people who drive Priuses. And it's not from the automobile that they drive, it's that other factors in their lifestyle. People who drive Priuses are less likely to smoke cigarettes and, do other things that, or be obese even maybe perhaps. So we have to be very careful about linking causality to correlation. And the challenge, of course, with diets, there are very few good human causal studies with diets because they're just you can't it's almost impossible logistically to run them. So most diet information that humans have to base their knowledge on are epidemiological studies, which are correlations, which are notoriously unreliable. So
Hmm.
so do I eat red meat? Yeah, I do. I do now. Um, meat meat has a lot of nutrients. It's a source of many different things. When I was a vegan, I would have to pay really close attention to make sure I was getting those other ways. With meat, you can practically just eat meat. You don't need to eat anything else, and you'll be perfectly healthy. So I do eat red meat. Um, as far as the question you raised is really important. It's not just important for meat eaters, but also vegetable eaters. In other words, it's not enough just the end point, but it's how they got there. In other words, meat today is fed, they don't eat grass, they eat corn. And corn is low cost because it's subsidized. That's why high fructose corn syrup is so cheap. But they're fed corn, and corn is high in omega sixes, the same stuff that's in vegetable oil and
Yep, yep.
these other things. So the quality of meat, if it's corn fed meat, is going to be different than grass fed meat. And